Welcome to week 7 of ethics. This week we're going to cover chapter 17, which is Impaired Nursing Practice. Is progress being made? And normally I don't use the PowerPoints in this class, but some of these PowerPoints I like, and they kind of answer some of the questions that may have been on your homework or that you may see on one of the last quiz that you're going to have in this class, which will be next Monday. I'll open it at 10 o'clock on Monday and close it at 10 o'clock on Tuesday. So that'll be May 4th to May 5th. So definition, what is impaired nursing practice? It is professional judgment is impaired due to the effects of the drugs or alcohol or mental illness, and this compromises patient safety. Impaired nursing practice is poorly understood, under-researched, and under-reported. The problem of impaired nursing practice has plagued nursing for decades. However, it continues to, like I said, remain poorly understood, under-researched, and under-reported. What are the barriers to nurses seeking treatment? Stigma, fear, humiliation, and concerns of punitive measures. However, there are two key issues that surround impaired nursing practice. The first is the concern for patient safety, and the second is the concern for the health of the impaired nurse. So remember that the two key issues, number one being the concern for patient safety. Also, examples of drug diversion include substitution, removal of medication without orders, frequent medication overrides, salvaging from waste, and reduced or skipped doses of medications. Patient safety is also compromised when nurses are impaired because of alcohol or substances obtained from outside the workforce. So this slide here, it's the prevalence of the problem. Estimates of the prevalence of substance use disorder in the nursing profession are varied. Efforts to quantify the prevalence are fraught with problems. It has been suggested that the difficulty may be due in part to the fact that self-disclosure is reduced because of the stigma, shame, and denial. And they've done some research on it. They have reports, but previously it has been suggested that prevalence is not as important as patterns of substance use among health professionals, such as physicians and nurses. Although examining patterns may still be important, the critical consideration must be the performance of the nurse and whether the nurse is making safe, appropriate decisions in the provision of quality patient care. The current belief, can nurses practice safely? That's a question to be asked. This one here, the joint position statement of the Emergency Nurses Association and the International Nurses Society on Addictions, they have 4 distinct areas of focus. Importance of education about substances, the availability of alternative to discipline programs with suitable return to work goals, considering drug diversion as a symptom of a problematic substance use, and the risks related to substance use are understood by both nurses and nursing students. On page 245, underneath the overview of literature, they talk about over 95% of self-identified impaired nurses were currently employed and unknown to their employers as having a substance use problem. Also, another person who had done a study by the name of Cook, he discovered that nurses were willing to trust recovery nurses and found strong agreement that they should be able to return to work in healthcare. So, everybody does have a difference of opinion of whether they should be able to return to work, whether they should not. They also, the rest of these individuals also did studies regarding, impaired nursing. So you can read those on page 245 to 246. That one quite yet about the ANA, but there's ways to identify early detection behaviors and barriers to seeking treatment by nurses who use substances. Behavior cues such as changes in physical condition, pain medication discrepancies, absenteeism, increase in wastage of drugs, missed doses, and barriers to self-report such as fear, embarrassment, confidentiality concerns, and loss of their license are among some of the findings that they have found in some of the studies that they have done. The American Nurses Association, or the ANA. Remember, the position of the ANA is clear, and the position of the ANA is on page 249, second sentence in the top paragraph on the right side. The position of the ANA is clear. It is the ethical and legal duty of a nurse to advocate for public safety, their colleagues, and the profession. However, ANA does support treatment as opposed to discipline and a process that facilitates re-entry of the recovered nurse back into practice. Remember, the ANA supports treatment as opposed to discipline and a process that facilitates re-entry of the recovered nurse back into practice. And the position of the ANA is it is ethical and legal duty of a nurse to advocate for public safety, their colleagues, and the profession. So what that means, it is a nurse's job to protect the patient from harm. If that means reporting an impaired colleague, that is what one must do. The AACN policy is in agreement with the ANA regarding the importance of treatment over a reasonable time frame and a process for successful re-entry into practice. So, the thing of it is, a lot of times with impaired nursing, it is that the reason they don't report is that confidentiality, because some nurses feel that some managers don't keep that information just to themselves, and they like to share it with everyone else that they work with. So, it is very important as a manager to maintain your confidentiality regarding your staff members. So also, and then this is the NSSBN. Their study, they support early detection and treatment with a goal to return to practice. The literature is filled with all types of recent research related to impaired nursing practice. No, it is very limited. The literature research is very limited. Nurse reporting, this is on page 249. It is imperative that the healthcare organizations and educational institutions have a policy in place about impaired practice that clearly identifies a process to be followed if problematic substance use is suspected. And that impaired nursing practice, discussion about impaired nursing practice begins during the hiring process And it's very important to review information about identifying impaired colleagues and what the hospital's guidelines for reporting should also be included in the hiring interview. It is a responsibility of every nurse to be aware of reporting requirements when a colleague is suspected of problematic substance use or of diverting drugs for personal use. The problem is there is no uniform agreement among states for reporting requirements. So it is very important that you know your state's reporting requirement, and that information regarding those requirements can be found from each state board of nursing, which can be accessed via their website. You know, you have to be able to recognize, and their impairment, what are common signs and behavioral changes that are related to impairment. But, the thing of it is the lack of clear protocol or the process for reporting or intervening, and the lack of compassion in the workplace for peers. And, they just found, and they also found that the word confrontation itself was a barrier to reporting, and that perhaps more compassionate terminology would help. And this information is in all different types of literature that is out there. But usually the barriers to reporting is the lack of clear protocol or process for reporting or intervening, and the lack of compassion in the workplace for peers. Historically, the code of silence, it was possible historically that it was the code of silence. Currently, there are other reasons that individuals do not report their colleagues. And also on page 249, nearly 75% of nurses have worked with an impaired colleague during their career. That's a pretty high percentage. Nearly 75% of nurses had worked with an impaired colleague in their career. And, we already talked about the barriers to reporting, and that it is essential for every facility and educational institution to have an impaired practice policy. They suggest leaving the no confrontation unless a plan, do not confront someone unless there is a plan in place. There are procedures to return to the workplace. They may have to sign a contract. There may be restrictions on them handling narcotics, and they may be subject to random urine testing. There are alternatives to discipline diversion programs. But before we start on that one, I want to talk about drug diversion on page 250. It's, it's like the second paragraph down under drug diversion. The most effective way to prevent tampering is to make it difficult to divert. So, a lot of facilities have put PICSA systems in, which makes it harder. You never, ever, ever want to share your password or sign on into any system. But, they have to make it, they have to put into place different, more effective ways to prevent tampering, to make it more difficult to divert. Factors that contribute to drug diversion that have been identified elsewhere are increases in workload, mandatory overtime, floating to unfamiliar units, fatigue, and medical issues requiring the need for prescription pain medication. A common factor identified in the literature is that easy access nurses have to controlled substances. And other studies have stated that, or identified other issues that have been identified contribute to the problem are the reluctance of nurses to believe that a trusted colleague is diverting drugs. And that is other information that has been presented in studies, and that is one of the issues that has been identified that contribute to the problem are the reluctance of nurses to believe that a trusted colleague is diverting drugs. They disbelieve it. They do not believe that a colleague would do that. Alternatives to discipline programs. The first treatment offered in the United States was the Intervention Project for Nurses in Florida in 1983. A different approach that another state has is the Texas Peer Assistance Program for nurses, and that program offers services to nurses suffering from chemical dependency as well as from anxiety and other mental health disorders. It requires abstinence, maintains confidentiality, is strictly voluntary, and is independent of the state licensing board. And then California also offers a diversion program. It was established in 1985, and its goal is to protect the public by early identification of impaired registered nurses and by providing these nurses access to appropriate intervention programs and treatment services. They can be self-referred, they can be referred by family, co-workers, or the board. All licensed nurses residing in California are eligible to enter the program, but they must agree to enter the program voluntarily. The next one that they talk about is a recovered nurse and re-entry into practice. You know, issues of whether a nurse's practice is limited or restricted in some way, how long the nursing board has a right to invade the nurse's privacy to ensure that recovery is ongoing, where organizational responsibility ends, and who bears the cost if the nurse does not return to work at full capacity. And then you have to maintaining confidentiality of the returning nurse might be a goal, but there is a question of how that plays out in practice, especially if they have restricted access to narcotics. Employers often require the completion of a return to work agreement or contract between the nurse and the organization. And of course, a question that is left unanswered is how long the board follows a recovered nurse in terms of random drug testing. Some hospitals or healthcare agencies already do random drug testing, so the question of invasion of privacy has in some instances already been dealt with. And then the other thing that we had talked about was including impaired practice policies, during hospital orientation for new employees and during an annual review. Every year you have to do your annual reviews. So it has been talked about during the annual review of hospital safety. Another question is, how can we stop losing nurses to substance abuse? Perhaps one avenue is to more fully explore the experiences of nurses who do not turn to substances. Do nurses use self-care strategies to cope with stressful work environment and to prevent burnout? Also use those same strategies to avoid harmful substance use. Student nurses need to not only be made aware of the risk of substance abuse, but also to be self-aware about their attitudes and beliefs regarding those who do abuse substances, whether those people are patients or maybe their colleagues. Of course, like the book says, nursing school is an incredibly stressful time for students. Not only could appropriate education in nursing school help prevent the onset of substance abuse, but it might also allow students to explore their feelings and beliefs about impaired practice. So, this slide here is, talks about, you can go on to the board's registered nursing websites. They have information on there regarding the reentry process, but a lot of times they will tell you, if you call and talk to them, that it is on an individual basis. Each case is individualized. They may have a last chance agreement. They may do, like I said, written contracts, what is the expectations, and their attendance at support groups. So, the thing of it is healthcare facilities as well, that even includes education, they have a need for impaired practice policies. Many nurses they're not aware of those policies. So, like I stated, that information should be part of the orientation process as well as the annual review of safety procedures. And these here are just, you can review the rest of these slides just for your own information. But, think about a conclusion to this lecture is losing one nurse to substance abuse is losing one nurse too many. And so, the harmful coping strategies that lead to substance abuse can begin even before nursing school. We need to educate our students to help them to increase awareness about this ever-present problem, because that problem is out there. Because think about it, where the literature stated 75% of us have worked with an impaired nurse in our career, and some of those nurses that you have worked with, you would never even recognize some of the signs. So, last but not least, all nurses who suspect an impaired colleague need to take action, as they have an ethical, regulatory, and legal obligation in the interest of patient safety. So remember, all nurses who suspect an impaired colleague need to take action, as they have an ethical, regulatory, and legal obligation in the interest of patient safety. That is the end of Chapter 17. Like I stated earlier in the lecture, you will have a quiz next week. On Monday, I will open it at 11 a.m. on Socrative, and I will close it on Tuesday at, I said 11, I meant 10. I will open it at 10 a.m. on Monday and close it at 10 a.m. on Tuesday. You guys have a great week.